So just let it be life.
Yeah, let her know, babe.
Hello, TikTok. I am trying something new. Hello, YouTube. Trying to go live on both. We'll see. I was always a multitasker, so we'll see if I can pull this off. You have the choice of following me live here or heading over to my YouTube, Tara Scott MD. But I used to every week go Tune In Tuesday on live. And I told myself that if TikTok comes back, I'm going to get back to my lives. I used to do it for the last couple of years, but I haven't been able to do it. So I have my assistant out of the frame who will be helping me with questions. And hello to YouTube. If you guys have any questions, type them in the chat. You may hear someone feeding me questions, but hopefully I'll be able to hop on here for about half an hour or so to answer any questions you guys have about menopause, perimenopause, teens with acne, teen hormones. It doesn't even have to just be women our age. Any questions that I can have. So thank you guys for joining. If you want to tell me where you're joining in from, go ahead and type it in the chat. If you're not following me here and you haven't signed up for our free newsletter, go ahead and click the link in my bio here. And hello, YouTube. And so let me know. South Carolina, Jenny, well, it is super, super cold here. So I'm jealous about South Carolina. It is like -8 today, feels like -18 or something like that. Finger Lakes. Oh, the Finger Lakes. So my daughter went to school in Ithaca. Hi from Texas. I'm headed to Texas in March to speak at a conference. Jenny, it's -8 here. Did you say you were in South Carolina and it's -8 in South Carolina also? Jeez. Well, it is definitely cold in Northeastern Ohio as well. So let me know if you guys have any questions about anything hormonal. Oh, you are, and snowing. Well, we're headed to visit family this weekend in Atlanta, and I thought, oh, I'm going to get a break. But guess what? It's like currently 22 degrees and snowing in Atlanta at all. Okay, questions coming in. You keep an eye on YouTube. I've been having clotty, flooding periods. I want to do something natural, but they put me on Provera. Okay. So the issue with heavy periods generally means a lot of estrogen. So there's a few things that do help. I mean, you can use a nonsteroidal like Advil that will decrease the flow, but then that's going to probably wreck your stomach. There is a prescription medication called Lysteta, a tranexamic acid, which just temporarily to slow the flow may help. And it comes in generic, so you take 2 pills up to 3 times a day for 5 days. You may want to ask a gynecologist to write you that till you can figure out what's going on. Other things that could be going wrong is you could have a problem with your estrogen detoxification. So things like magnesium could help cramping, DIM, which is extract from broccoli, kale, and cabbage. That may also help, but if you are able to find a provider that can check your hormones, that might be helpful. Atlanta is snowing. Yep, I did see that. So I'm hoping it gets a little warmer. Jenny says, I'm 52 and I have super heavy periods that keep me home and I'm feeling murderous. So if you're still having periods, it's technically not menopause. It's definitely perimenopause, but you shouldn't be suffering. Like if it's keeping you home, we call that social menorrhagia. So that's not normal. If it's bleeding to the point that you have to know where a bathroom is or you can't eat, you're soaking through whatever protection you're using in 1 to 2 hours, that is significant. And there could be a lot of causes. It's generally related to too much estrogen. So it could be a lack of progesterone. It could be the way your body handles estrogen. But the bottom line is you don't have to suffer. Now, some traditional causes that still could be an option for you are an IUD to decrease the blowing while you're trying to figure out what's going on, an endometrial ablation, and other medications to slow the bleeding down, but also at the same time trying to figure out why. Micronized progesterone could also be an option for you as well. Christina, you have a history of blood clots also. So that could be part of the issue. If you have a thrombophilia, that can also be a cause of heavier periods. C. Barton, wife and I have been on a learning journey for her hormones from us. Oh, wanting to visit you in Ohio. I'm in Northeastern Ohio and I have people, because of my license, I have to see them first in Ohio. So people have come. I've had people stay in Cleveland, go to the Rock and Roll Hall of Fame, go to the Cleveland Art Museum, take in a Guardians game or whatever, a Cavs game. And so you have to be seen the first visit live. Chilling with Andrea. Menopause just started the patch. Any other pointers for this chapter? Chilling with Andrea, basically, if you're menopausal, there's a few things that I recommend, the 4 kind of pillars. The first thing is you wanna really try to get a handle on your stress. So what does that mean? Figure out what works for you, whether it's meditation, whether it is, um, yoga, something that you have a tool for stress. The second thing is be careful about what you put in your mouth. Most people do pretty well with an anti-inflammatory diet. Doesn't mean you have to get rid of gluten or dairy, but just eating whole foods, whether you're vegan, whether you're carnivore, whether you're paleo, stick to very little processed food, decrease your sugar, decrease your alcohol. Anybody else doing dry January? We're doing dry January. So it's what is it, the 21st? So we got another 10 days of it. Um, and movement, it's really important to figure out what you like and make sure you're getting your steps in and making sure that you are definitely exercising. It doesn't have to be running a marathon, but you got to do what you like to consistently. We focus on adding strength training when you're in that perimenopause and menopause because of bone health. And then also sleep. Just make sure you're sleeping. If you can't get to sleep, it could be also your hormones. Christina, you said hormones are normal. So I'm wondering what time of your cycle they checked them. If you actually look at the normal ranges for estradiol, if you just look at the ranges, any any value is normal. It will not often, almost never be abnormal. But if you don't know which range to look in, it's quite possible that your levels are abnormal, but the person that is looking only looked for that little red H to be there or the little blue low. So they may not be normal. A lot of times people come to me and they say, "Oh, I checked my hormones," and they're not either done at the right time of the cycle and they're not normal. Kelby, third year med student about to start OB-GYN rotation. Any advice? Okay, wow. So when I started my OB-GYN rotation, it was my last rotation of my third year. And I already kind of thought I wanted to be a pediatrician or internal medicine. And I'm like, I'm not going to be an OB. Like, what do I want to do? Stare at vaginas all day. And I was in my first delivery and was like instantly hooked. So follow people, take the initiative, stay late. If you have a laboring patient that's close to delivering at 5, don't leave at 5, stay. That'll be the ways that you will, get pointers and get to experience things and really just prepare that you're not going to get very much sleep for that rotation. Jen B asks, what is perimenopause? So the typical definition, according to the straw classification in 2012, says once your period stops, or not stops, but once your period changes from normal length to 1 week later. So if you have a normal 28-day period and then you have a 35-day period, by definition, that's perimenopause. Now, using that definition, it's also time of variable production of estrogen. So you could have high or low estrogen, and it's when your eggs are old and they require a higher stimulation from FSH, which is the brain, to get your eggs ready. So you can have huge swings in estrogen. So generally, now by that definition, Gen B, it can last 10 plus years. All right, let's see. I have to kind of go back. There's a little lag on the questions, so I got to go. Okay, here we go. Can you go on HRT if you have fibroids? Sherry Rose, yes, you can. So, based on the studies on fibroids, they are potentially stimulated by estradiol and progesterone. So, you really want to make sure your dose is okay, and it depends on the size of the baseline and where they are located. So, you definitely want to make sure you have a baseline ultrasound to document what size the fibroids are, but that's not a reason you cannot take hormones. And 80% of women at the time of menopause have fibroids, so it's not a reason you can't take it. H is there any natural cure for cortisol in teens causing nausea in the morning? That's so interesting. I also want to know in that teen if there's a problem with estrogen and progesterone because estrogen is the one that really causes nausea. But you're right, cortisol typically. So you'd want to probably think about something that could decrease her. I mean, if you can get the teen to do any kind of meditation or breath work, that would be great. Phosphatidylserine may be something good at night to help lower that cortisol in the morning. Rhonda Lent, sometimes we don't have a choice and have to go to work. I wonder if that's why my OB-GYN blew off. Sometimes we don't have, oh yeah, so you're talking about your periods. Yes, you're right. But that even if you have to go to work despite the fact that you're bleeding doesn't mean you should have to put up with that amount of bleeding. It's not normal and it should be treated. And you might need to have traditional treatment, as I mentioned, like an endometrial ablation. But the point is, I wouldn't give you the advice to keep on tolerating those heavy periods. I need help to do not make my kids. User 2639. I'm not sure what you mean by that. C. Barton feels like for sure she's estrogen dominant, heavy flow, painful. She randomly misses a whole cycle. So that is the craziness about perimenopause. You could have one cycle where you're totally high estrogen, and then the next cycle could be low estrogen, but doesn't mean you can't mitigate the symptoms, and that intervention can be helpful. Gennard H., how do you balance out high estrogen? Well, first of all, we want to know why. And if it's something that your body isn't getting rid of it, that's why I do like the Dutch test, because it looks at your estrogen metabolism pathways. Those are genetically coded, and they are also affected by other hormones and foods. So sometimes something like DIM, diindolylmethanol, can be helpful. Sometimes magnesium, B vitamins can be helpful. Sometimes it's a cortisol issue. Sometimes it's a gut issue, because after your liver detoxifies estrogen, it has to go into the gut. And so a lot of Americans don't eat enough fiber. So we determine where there's issues and then try to work on that. Okay, YouTube, vaginal atrophy, any treatments other than vaginal estrogen cream? Okay, great question. So I actually just reviewed this for the fellowship lectures that I'm doing, and I used to tell people to use coconut oil. But what I didn't realize is that caprylic acid can affect the microbiome in the vagina. So it's not really the best thing to do. You could use it externally, but not in the vagina. There are some over the counter like Replens and things with hyaluronic acid that can be really helpful. Also, there's a prescription vaginal DHEA that is not estrogen. It's not stimulatory like estrogen. It's called Intrarosa. That actually could be an option for vaginal atrophy. Key E suppositories is something else that my patients have used, and that is vitamin E. I'm not sure what the base is, but there's a few other things that can be helpful. Julva is my friend, Dr. Annika Becca, who's also triple board certified like me, OB-GYN. It's really made for external, but there's a little bit of DHEA in there. There's rose hips, and it's like a really emollient cream, mostly from the outside, but that's a great question. I have the most insaneful period cramps. Okay, what has been shown to help period cramps besides the anti-inflammatories that I mentioned? Magnesium can be really great for that. Evening primrose or fish oil can also be helpful for that. And again, username 4545676. If you were my patient, I'd want to know why you have those bad cramps. I'd want to look at your hormones and check that. Kuru, can obesity cause low testosterone? That is a great question. I don't know if you're referring to male obesity and male low testosterone or female obesity and low testosterone. Either way, obesity upregulates an enzyme called aromatase. Aromatase is the enzyme that converts testosterone to estrogen. So it's a vicious cycle in a man that your testosterone is feeding estrogen and your testosterone is low. Think about men with the pregnant bellies and the man boobs. That's actually estrone. So estrone is what causes that. So yes, obesity can contribute and insulin resistance to low testosterone in men. Now, what about in women? Well, it's a similar enzyme that does the same thing. You just have different quantities of those hormones. So yes. Jules, how do you suggest I find a doctor like you in Boston? Okay, how do you find a provider? I've done several videos on this, but I'm going to go through it again. The directories that I would recommend, one of them is the letter A, the number 4M, a4m.org. Org, I think. It's either org or com. And so that is the fellowship that I trained in and I now teach for. They have a provider directory. I think it's in the upper right-hand corner. You click on provider directory, you put in your zip code and what radius. Do you want someone in a 50-mile radius and a 100-mile radius? And put in either bioidentical hormones or someone who is fellowship trained and board certified. Okay, that's what I would recommend. Someone who's done all the training, because like any directory, if you just pay your dues, you can be located on the directory without having the same amount of training and experience. You can also look at menopause.org and you could look there, and that would be a certified menopause practitioner. They do have extra training in hormones. They're not afraid to prescribe hormones, but they're not really going to probably check hormone levels. And so they're going to stay pretty traditional, but those are still options for you. Does progesterone lower high estrogen? Danielle, that is a great question. Progesterone will down regulate the estrogen receptor. So a receptor is like a door, and you can't get into the room without opening the door, right? So you can't do anything in that room unless you open the door, or think of it as a bouncer, maybe even someone standing at the door. So progesterone will decrease the estrogen receptor. So in essence, it doesn't really lower estrogen, but it can lower the effect of estrogen. Hopefully that helpful. Okay, R Will 03. Do these items you suggest also help with the urinary issues of vaginal atrophy? Of those things that I suggested, the key E is probably more for internal things like painful intercourse, but the Julva, which is available on Amazon, would be something that would really help. You could put it around your urethra, around the outside also. Hi, Mrs. Singh. Thanks for tuning in to our YouTube live. Okay, I need help to do not make kids. Oh, okay. I'm not understanding your question. Mary Val, I'm in from New York Metro and see her. I flew. Oh, hey, Marie V. I know who you are. Hope you're having a great day. Thanks for hopping on my live. Okay. Anxiety help, creative by Gil. Okay, so here are some things that can help anxiety without knowing what the reason is. Decreasing sugar and alcohol, and also and trying some magnesium, specifically Neuromag or magnesium L3 and 8. Those are things that can really help. Some people find an improvement with B vitamins. Some people find an improvement with fish oil. Some people also have some improvement with 5-HTP, which is a precursor to serotonin, but that depends on a lot of things. What are the hormones that feed anxiety? Too high of estrogen, too low of progesterone, high cortisol, and low androgens. Okay, 51, Sarah L. Linus. 51, history when I was 28, how to track menopause with no cycle. History cervical cancer. Okay, if you are 51 and you had your uterus removed because of cervical cancer and you still have your ovaries, it is more difficult for you. The definition of menopause, which is normally 1 year without a period, you won't be able to have that definition because you have no period. So you will need 2 blood draws 4 months apart with the FSH greater than 40. Now, we would check much more than FSH in those. We would also check an estradiol, an estrone, and a lot of other things. But that's how we would treat a patient like you. Christine, what's your opinion on GLP-1s for PCOS? Actually, we've had really great results with GLP-1s for insulin resistance because that's essentially what it is. It's a medication that treats diabetes. And in those patients that got that for diabetes, they had an increase in weight loss. So if you think about what's happening in insulin resistance, you eat and your blood sugar goes up, then your insulin goes up and you have a lot of insulin. So guess what? Then you have a blood sugar that goes down. Then you have a really low blood sugar. So glucagon goes up because it's more dangerous for you to have a low blood sugar. And so that GLP actually helps make that yo-yoing a little bit more even. So we have actually had really great success with our patients with insulin resistance, high cholesterol, prediabetes on GLP-1s. Okay. What are some ways to lower high cortisol? So it's been really hard to release 15 pounds with high cortisol. Yes, cortisol doesn't know if you're running from a bear or if you are stressed at work. So it's going to have a net effect of increasing your blood sugar. So the things that have the most data to lower cortisol are meditation, breath work, and yoga. But you have to find what works for you. If it's walking outside in nature, that works. If it's snuggling with your dog or cat, that works. Knitting is something else that's really great. It will decrease your blood pressure, decrease your heart rate. So you have to find for you what works and be consistent. What do I think, Kaylin? What do I think about tamoxifen? Tamoxifen is a selective estrogen receptor modulator. So what does that mean? It means that, as I talked about before, you have an estrogen receptor. That's the key to getting in the door into the room. So it's going to sit there. But tamoxifen is a very weak blocker of estrogen. It's stronger at blocking it in the breast, but it's not very strong. It actually does the opposite in the uterus. So those patients have an increased risk of uterine cancer and endometrial hyperplasia. So I just don't think it does a good enough job for somebody who makes a lot of estrogen. And I have a lot of breast cancer patients who are making a lot of estrogen and they're on tamoxifen and they're still having a lot of estrogen in their body. And that makes me nervous because what is it doing to stimulate the breast? So Okay, let's see. Natalie King, I've been doing the 30-33 and 30-33. Is it 30-30-30? My gut is feeling better within days. Natalie King, are you talking about carbs? Are you talking about eating window? Or I'm not sure really what you're talking about. Okay, user 500-246-358. I had a hysterectomy. There is a little bit of a delay on the messages, guys, just so you know. So I'm a little bit behind. I had a hysterectomy with ovaries still intact. I'm 46. How will I know in menopause? I did answer that question. 2 blood draws 4 months apart. That's the only way for you to really tell. 30 grams of protein within 30 minutes of waking up and 30 minutes. Oh, that's really great. I've heard some good things about that. So I think that's what you're saying, Natalie. And I think a lot of women don't eat enough protein. Okay, DRC, super bloated, 100 milligrams of progesterone, zero point 0.5 of estradiol. This is the second time changing different doses. So are you, that's a medium dose of estrogen, a low dose of progesterone. It's hard to say which one is causing the bloating. Are you having breast tenderness also? If you're having any symptoms of breast tenderness, that makes me think it's more the estrogen. A lot of people have bloating from the commercially available generic progesterone because it's not slow release. So some people do a little bit better with a slow release. Okay, back to YouTube. I now have extreme anxiety. I'm 54. That's been my biggest symptoms. Why is that? Amy Z, are you done with periods? Have you skipped periods? We see all the time new onset anxiety. Based on your age, I'm thinking that you are not having a period, but it's pretty common to start new onset anxiety in your 40s during perimenopause. So, but I also see I've had several patients that panic attacks. It's menopause. It's low estrogen. So hopefully you can get to somebody and get your hormone levels checked. Mrs. Singh, check out our website. You can get all that information about being a patient at forumhealth.com. We're Forum Health Akron. So Amy, yes, panic attacks. So yes. Okay, Ashley Mayo, my fingers and toes hurt. Okay, I'm just trying to go back to this. Some of these way back. Sorry, guys. Okay. Okay, let's see. Yeah, I'm way behind. I don't know what the King James means. Okay. Gosh, hold on, guys. Okay. I answered that one. I answered this one. I'm trying to make sure I don't miss anything, guys. Okay, Ashley, my fingers and toes hurt so bad, either my menstrual cycle or when I'm ovulating. If it's on your menstrual cycle, that makes me think you're sensitive to the drop in estrogen and also probably ovulating when you're ovulating. So some people are super sensitive to the increase in estrogen than the drop in estrogen. So that makes me think that it's estrogen related. You could try a natural anti-inflammatory. Also, again, would be really helpful to get your hormones checked. How do you, DRC, how do you feel about staffing to see if I can figure out if it's staffing to see if it's number one of the other causing? So what we would do with you, DRC, is we would actually check your levels at the times where you're having symptoms. Can you talk about Dutch test and if it's important for you? Seen others talk about pathways. C. Barton, we do currently use the Dutch test, which is the dry urine complete test of complete hormone. I've been using it for about 10 years. And actually, I collaborate a lot with them in their educational programs. So I am a fan. I use all types of testing. I don't believe there's only one test that you can use. I do about 95% of our patients get blood testing. So we think that, blood testing is what we have the most information about, but we also do saliva and Dutch blood test, urine testing. So that's important for us to talk about how you're getting rid of estrogen. Okay. Margaret, thanks for joining. Can the estradiol patch 1 milligram cause dense breast? And if what are the symptoms? If you're talking about 1, I'm thinking you mean 0.1, and that is the highest dose. So yes, I would think that would be responsible for breast tenderness and a lot of symptoms. We normally start with the lowest dose, which is 0.025. Then there's 0.0375, 0.05, 0.06, 0.075, and 0.1. I don't have to use that high dose very often. So I think it might be too high of a dose for you. Is it better to enter menopause at a later age? Tilted epiglottis, that is a good question. Speaking since I'm 56 and still not menopausal, and I was just thinking today, oh my gosh, am I going to be like the oldest person I ever know that is not menopausal? But I have had patients that were 57. I know my mom was late in menopause, and my older sister also late, so I'm not freaking out about it. But theoretically, to have your hormones longer is probably better, but then we're exposing your body to more estrogen, so it really just depends. I mean, there's a lot of things that after menopause, your brain, your bone health, and those things don't get the same thing. Um, so I think it could be good. Fit mommy. I'm 29, had a period since I was 10. I have all the peri. Is it possible this early? Fit mommy, if you started your period at 10, it's a little bit on the early side. So you are not too young to have problems with probably estrogen dominance. So it's not specifically estrogen or perimenopause, but yes, absolutely, you could have it. EM, do I believe pellet BHRT is better than patches or cream? So the pellets are only available for estradiol and testosterone. You can't have a progesterone pellet, they don't make them. For testosterone for men, I think they probably can work pretty well because there's not as much variation. For women, I often see that the doses are really high because you stick it in and it has to last. So you're going to get this really, really high peak and then down. So for estrogen, we have so many other options that we can titrate the levels and get a little bit more steady state in a patch, a gel, a cream, and cost a lot less and can get some coverage for insurance. So it works really well with our patients. Amanda Leanne, how do I advocate for myself to get checked for endometriosis? Ugh. If you currently diagnosed with adenomyosis, if you have adenomyosis, you essentially have endometriosis because adenomyosis is endometriosis in the uterine muscle. So you have endometriosis with adenomyosis. So you may be able to, without the surgery, to diagnose endometriosis. Unless you want to have excision surgery, then you need to see a proper endometriosis excision surgery, usually a laparoscopic expert. But you may be able to try some of the medications for that. Okay. Always feel like I have a UTI symptoms on hormonal birth control. Goes away when I'm off. So yes. So what hormonal birth control pill does is it suppresses ovulation. So it can cause vaginal changes in the microbiome, and it also can cause vaginal atrophy changes, even in someone who's on a birth control pill. So as a result, you can have some problems with frequent UTIs. One of the things that I tell my patients, KM, is check out UQORA's supplements. They're really great for frequent UTIs, and I think you can find them at not uncommon, but not normal. And if you're a patient, I would get some labs checked on you. I would check your prolactin, I would check your thyroid, and I would check a full complement of female hormones. I don't know if you've had stress or not, but that could be part of the issues. Mr. Singh, thank you for hopping in. Please subscribe to our YouTube channel so you can catch our lives. Christina Faraj, do people come to you after taking GLP to help them regulate their hormones again? Yes. So we actually also use the GLPs in our practice. So we will see them, and everyone who wants to use the GLPs has to get their labs checked. They have to get their insulin, their glucose, their thyroid, their female hormones. They have to get everything checked, their metabolic markers, before we'll prescribe the GLPs. So there were studies that people using GLPs in menopause when they were on HRT actually did better on the GLPs and had more weight loss when they were hormonally balanced. Okay, I'm getting some interesting comments. Jules, is it possible that I'm 48 and not in peri yet? I still have a period every month, regular periods. Yes, it is possible. So that doesn't mean that there's something wrong with you. Can perimenopause age 53 cause psoriasis flares? Yes, CT soap and candles. I absolutely have noticed in myself my eczema flares based on my hormones. Remember that estrogen is anti-inflammatory, and as you have drops in estradiol, you're going to have more inflammation. So that could be. Up Daisy, would you recommend an IUD or an ablation? So the difference between the two is if you get the IUD and you don't like it, you can get it pulled out. It's not surgical. It's an office insertion, and it can really help. I personally had an IUD it really helped for my endometriosis and my pelvic pain. And my periods. The ablation is a surgery, and although it is a minor surgery, there is no incision and there are some risks, but it's still a surgery that you have to have at least some kind of general anesthetic. You don't have to be intubated. So I would probably recommend the IUD first. You might be able to get it covered by insurance. I don't know. For medical management, it depends on your insurance. Jenny Hope, I have two painful periods a month, around 9 days long and 2 to 3 weeks in between. Jenny, that is not normal. It may, you may not have a pathological problem, you may not have a cyst or a tumor, but you don't have to suffer with those kind of periods. That is a sign of too much estrogen. Do you recommend any supplements for perimenopause? H. So some of the things that can really help for perimenopause actually depend on what you are, if you're trying to treat a symptom, but my overall favorite ones are magnesium, specifically glycinate. A good probiotic is something that could be really helpful for perimenopause, as well as vitamin D, usually with the vitamin D and the K2, and also B complex can be helpful. Baby Gal C, what do I recommend for PCOS? My favorite supplements for PCOS are inositol, 1 gram twice a day, and Vitex. Can you speak to the safety with IUDs? I'm concerned regarding the recent reports. Okay, for first of all, Marie V, the IUDs, if we're using them for contraception, that's one thing, to prevent pregnancy. I am not a fan of using the IUDs for hormone therapy, certainly not for menopausal hormone therapy. Now, as I mentioned, just with the question I had before, sometimes we need to use it for endometriosis or pelvic pain, and that is a non contraceptive benefit. But like any synthetic hormone, there has recently been an article published that there was an increase in breast cancer risk compared to oral contraceptives, a 14% increased risk with the IUDs. So there is a change in breast density now. The IUDs then also, the ones in the 70s were more increased risk for infection, but the ones that we have now are not as much. Okay. Adenomyosis, they just put you on, Amanda, they just put you on progesterone. I'm thinking that they put you on progesterone, maybe. Let's see. It looks like there's some repeat. Should I be more concerned about my thyroid or hormones, JC? So yes, I mean, definitely it could be something that is going on. We always check a full thyroid panel on all of our patients when we're checking their hormones. Baby Gal C, do you know what's good for hyperplastic endometrium? So micronized progesterone is one of the things that we use to counteract that. Sue Wise over in YouTube, positive breast cancer 1 year ago, lumpectomy and radiation, oncotype score of 1. Is any hormone therapy out the window for me? That is a great question, is a very individual answer. So I see a lot of breast cancer patients post-treatment. And so we always look at your estrogen metabolism. We'd look at certain genomic indicators and we would look at your levels. But remember, there are many hormones of menopause. There's DHEA. That could be a safe option for you. And again, ideally, we want you to get 5 years from your treatment, ideally. So it really depends. But I know that it's going to be hard to find a provider that is knowledgeable about breast cancer and hormone therapy. So I know Dr. Corinne Mann is someone else. I'm not sure where she is. And I know I see a lot of breast cancer patients as well. User 1744376 does estrogen patch prevent atrophy? So estrogen patch is considered systemic, and estrogen therapy can be also an option for vaginal atrophy. It's systemic, and you could just do local therapy as well, but it will also help that. Okay, Kiana Hemingway, how to induce a period that's been missing for 3 months. So Kiana, you need to get some blood work. Make sure you're not having a thyroid problem, hyper or hypo. Check your prolactin, make sure you're not insulin resistant, and then we would induce a period. We would generally either use progesterone, 400 milligrams for 10 days. Sometimes I do have to use Provera, but I'd want to check all those things before giving you anything just to make you have a period. Lebna Kanafa, what can help night sweats? So some people think black cohosh can help, evening primrose oil. Micronized progesterone is another thing that can really help. Shannon Billingsley, only leg sweating while sleeping. 51 on Bijuva, partial hysterectomy. So Bijuva is bioidentical. God, I can't remember. It's oral estrogen and micronized progesterone. I'm pretty sure it's bioidentical, but it's estradiol and micronized progesterone. And the issue with that is the half-life of the estradiol. And think it only has two doses. Don't quote me on that. So it could just be that you might do better with an estradiol patch and the progesterone separately, because the estradiol patch is a constant dosing rather than the up and down of the oral. When you take oral estrogen, it also decreases your thyroid and your androgens because it increases a binding protein. Okay. I don't know what King James is, user 2639. If you're talking about LeBron, I'm a big fan because he's from Akron, but I'm not sure why you keep seeing King James, but I'm a fan of him if that is what you're referring to. Leah, my ears have been itching nonstop for a year. They say I'm in period, all hormones normal. Again, my question about your hormones being normal is what day did they check them? Did they check them on the third day of your period? Did they check them on the day 21, 1 week after ovulation? Your hormones are going to be normal if you don't know what range to look in. It's just like, how can I say that this? How can I if for example, your weight. How can you say that your weight is normal without knowing your age and your height? If you told me you weighed 50 pounds and you were a child, I would say that was normal. I would say that was severely malnourished if you were a teenager. So your hormones being normal, it depends what range you're looking at and what day you're checking them. I don't, I'm thinking that maybe your hormones aren't normal. KM, I always feel like UTI symptoms. I think I answered that question. Okay, let's see. Okay. Nancy, thanks for joining. If one has an FSH 11 but doesn't feel 100%, should she increase the hormone levels of estrogen is 68? Well, I'm wondering why your FSH is 11 because it is not menopause. That's not a menopausal range. And I'm wondering if you're still cycling. An estradiol level of 68 could be okay for someone who's postmenopausal, but for someone who's cycling could be a little on the low side. Wondering also what the rest of your hormones are: progesterone, testosterone, free and total, DHEA. So sometimes when you don't check a full complement of hormones, one might not feel like it's doing the job because you need all of them to be balanced. So it could be that. What can I do to relieve or minimize breast tenderness from dense breasts? Margaret, I think you were the one who I thought you were. I mean, I can't say because I don't know your situation, but it seems like you could be on too high of a dose of estrogen. So that would be my first thing is like maybe think about decreasing your dose. In the interim, evening primrose oil and DIM can also help your breast tenderness. Okay, let's see. Jenny, I hope that you can find someone that can check your hormones. Holly, holistic wellness, regular periods, but noticing darker hair on my face. What can this be? So the darker hair, first of all, people get like that peach fuzz hair too, but the darker hair on your face could be because the change in the androgens. And so you can still have regular, completely regular 28-day periods, but still have variations in your estrogen level. So the ratio between your estrogen and your androgens, namely your testosterone, is going to affect whether or not you have the dark hair. And what's surprising is people can have low estrogen and still have regular periods. Tuscaloosa, I think I've seen you before. Welcome back. My daughter gets a yeast infection every month in between her cycle. Wondering what time of the cycle is. Is it right before the period starts? Is it at ovulation? You might want to try giving her a probiotic. And I know there are some vaginal probiotics. She might not go for that, but just even a probiotic might be something that could be helpful. What can cause 2 periods a month as a 31-year-old female? So as 31-year-old female, it's generally not perimenopause, but it still can be estrogen dominance. So that's something that might be helpful to look at it. Okay, opinions on VRIL, VRIL. I don't know what that is. Okay, Kim. Yes, help with the nights. I was 43 and having them for 2 to 3 years, a week before my period. Kim, it sounds to me like you have low progesterone. Try to get someone to check your hormones. If you can't, some over-the-counter progesterone cream only during that week could be helpful. Margaret, I think you check in with your gynecologist, and I hope that, Margaret, you're also taking progesterone with your estrogen. Callista Crawford, I have a far-fetched question. I just got diagnosed with Behçet's disease. Do hormones cause flare-ups? That is not a common one that we hear about, but it's also a rare thing. Hormones affect inflammation. So if there's any inflammatory component to your Behçet's disease, yes, there could be a correlation. Okay, Jen Op, migraines before period, a week leading up to, and sometimes a week after. I currently have nothing for it. Caffeine helps and has been taking them for the longest. What can I do? The week before your period, it's usually the drop in estrogen and low progesterone. If they start on day 5, it's a low estrogen from a ramp up. So our migraine protocol is CoQ10 100 milligrams, B1 50 to 100 milligrams, vitamin D 5,000, and magnesium glycinate 500 a day. That's what we tell our patients to take every day. I also like the supplement Migranol by Designs for Health that has some feverfew in it. What causes 2 periods a month as a 31-year-old? Again, could be insulin resistance, could be thyroid, prolactin. I would get that checked. Martin Paula 21, severe sweating, not menopause, hysterectomy 20 years ago. Please pin message. So hysterectomy 20 years ago, depending on your age too, it could be a cortisol issue, it could be an androgen issue, DHEA, and that kind of thing. Okay. Can GLP-1 Zepbound lower hormones in women? It's me. So the GLP can help slow down aromatase. So it can help your hormones, but it shouldn't necessarily lower them. And Kiana, how to get your period back, it really depends on what the cause is. So the point is not just getting the period and making you have a period. The point is what is causing it. Okay, I answered the migraine question. Opinions on semen retention for men. 7 days of no ejaculation. Testosterone increases by 145%. Well, that does sound like a really interesting problem, but I think because I'm a gynecologist, I don't have as much experience on actually like problems with ejaculation. We do treat males' testosterone levels in our practice, but I don't think, Michael, that I'm the right person to answer that question. But thank you for stopping by. Let's see. I'm not getting a period every month. L. Wells. So, what are the main causes of not getting a period every month when you're not in perimenopause? Thyroid disease, insulin resistance, prolactin. Those are things that we got to check here. Okay, Katie Kennedy, been on birth control for 8 years and just switched to Paragard. Should I expect big hormone changes? It'll be really interesting, Katie, because now you're on a non-hormonal copper IUD. Hopefully that your copper and your zinc will be balanced and you won't have any issues with that copper. Sometimes people do notice a heavier period, but I'm glad that you're not getting the hormones anymore. And it'll be interesting to see what happens depending on how old you are. Stevana 59, do you have any advice for someone that is dealing with PCOS and is getting rejected? Stevana, try to find somebody who is actually trained in hormonal issues. It doesn't seem like many endocrinologists in my area treat PCOS. Gynecologists are so, but like people like myself that are OB-GYNs that now specialize in hormones might be a better fit for you. Okay, are there side effects to the Julva and Intrarosa? R-Will-03. Great question. There really are not that many side effects to the Julva since it's not systemic. With the Intrarosa, you can get a little bit more systemic because it's a suppository that you're putting a little higher up in the vagina. But DHE is really well tolerated, does not turn into estrogen in the vagina. It can help bone health. Some people, if you take too high of a dose, you can be sensitive with like acne or testosterone side effects, but pretty well tolerated. I mean, might be a little bit of irritation. The Intrarosa, the base might be a little irritating. Kaylee Aline, no period for 3 years, started bleeding yesterday, extreme pain, large clots. Oh, guys, I'm so sorry for those of you that have tried to talk to your doctor and haven't gotten the attention that you need and deserve. My only advice for that, having been a busy OB-GYN in the past, is when I was doing OB and GYN, I was seeing 45 patients a day. No excuse, but I didn't know what I didn't know. And now that I have the time to not see those OB patients and see just the GYN patients, and now I don't even do the actual GYN exams, that I have the time to listen to all you, and that's what I specialize in. So I guess maybe not, if you've tried your OB-GYN and you got your PAP and you got your pelvic and everything's okay, great. Try to seek out somebody. And now with social media, you can vet everybody and you can look at, everybody and find out what their specialty is in. Okay. My little prince, I found estradiol for menopause that works, but I bleed with cramps every month. I'm wondering about the dose. I'm hoping you're on progesterone also at a good enough dose, my little prince, and wondering also how long you had been without a period prior to starting that. Margaret, on my last hormone panel, my estrogen was 96. Wondering if that's high. My gyneco just think it's not high enough. I think it's a good level, actually. And you're the one I think who is on the point 0.1 patch. So what we don't know is what is the level that's best for you. Will DHA supplement work as well for vaginal atrophy? So it will, but I think it's best to use something locally first until you are better. All right, guys, it looks like my battery is on its way out. It's been about 45 minutes. I'm trying to get through some of these repeat questions. For those of you that tuned in, I'm going to try to get back to Tuesday nights. I do have some Tuesday night lectures scheduled ahead in March and April, so I won't be able to hit every Tuesday. I'm going to try to do YouTube. If you're not following me on YouTube, Tara Scott MD, follow me here on TikTok. If you're not, sign up for our free newsletter. And usually it's a factor of Tuesdays at 7. It's the factor of how long the actual battery will last. So thank you for those of you that have signed in. I'm going to try to do a couple real quick questions to see if I can finish up here. Natalie King, is the best way to balance your hormones getting your gut health optimal? That is an absolutely great place to start because that is the third phase of your estrogen detoxification. So absolutely. Katie, 43 and feel terrible before menstrual period. Is this perimenopause? It sounds like low progesterone for sure. Sierra Patterson, what causes joint pointing during ovulation? You must be sensitive to the extreme drop in estradiol after ovulation, and that's what's causing your joint pain. Okay. Can I comment on any association between HRT and autoimmune? Yes, Baroness Orsosi. There was a recent study that was published in the British Medical Journal that looked at hormone therapy and concluded that there was an increased risk of autoimmune disease with hormone therapy. But if you took a deep dive into what was studied, it was actually the synthetic progestin. There was none of those studies that actually looked at micronized progesterone. A few of them did use a bioidentical estradiol, but alone. So estradiol is anti-inflammatory. And when you go through menopause, we see a lot of people with autoimmune issues, higher in women than men. So there is a protective effect of estrogen. Chris, what do you think about the estring? That is a vaginal source. I'm glad it's not oral. There's not as much flexible with dosing. I think there's the femring and the estring. One of them is indicated for vaginal. All right. Well, sorry I didn't get to all the questions, but thank you so much for tuning in. And thank you guys on YouTube and subscribe to my channel. We will try this again next Tuesday. I hope you guys have a great week and stay warm. Even you in South Carolina that are getting snow and you in Atlanta and I heard the panhandle of Florida. Follow me here if you're not to get notified of my next live. Thanks a lot. I've loved your questions, guys. Have a good day.